Good afternoon, Senator Kelly. My name is Benita Furaha. I am a graduate social work student at Arizona State University. I am here, thank you for meeting with me today. I am here to advocate for critical reform to the Arizona healthcare cost containment system. Access. This reform is to request specific expansion for eligibility to better serve low-income individuals who are currently excluded from coverage. The aspect of access that requires reform is its restrictive eligibility criteria, which excludes undocumented immigrants and individuals who fall just above income threshold, commonly referred as the coverage gap. This policy fails to account for the realities of the economic instability and the high cost of healthcare. Many individuals who slightly exceed income limits still cannot afford private insurance, yet they are denied access to public coverage. As a result, they remain uninsured despite having significant health needs. Additionally, undocumented immigrants are categorically excluded from access regardless of income level, which creates a system where access to healthcare is determined not by need, but legal status and rigid income cutoffs. These exclusions contribute to disparities in healthcare access and outcome across Arizona communities. Research consistently shows that these gaps in coverage have serious consequences. Individuals without health insurance are more likely to delay or forget necessary medical care, leading to worsened health outcomes and increased long-term costs. According to Bentley and Koo, they explained that excluding undocumented immigrants from public health coverages undermines the fundamental principle of the right to health, which asserts that all individuals should have access to essential healthcare services. 2018. In contrast, research on Medicaid expansion demonstrates clear benefits. Berker and all other authors, 2013, they found that expanding Medicaid eligibility improves access to care. From a social work perspective, these outcomes reflect broader issues of social justice and structural inequality. In my work as a case manager, I have seen individuals who are working and contributing to be members of society, yet they are unable to access basic health care due to public barriers. Due to policy barriers, I apologize. The proposed reform is to expand access eligibility to include all income residents regardless of immigration status and to adjust income threshold to reduce the coverage gap. This could be implemented through a state-funded coverage program that mirrors Medicaid benefits for undocumented individuals like models adopted in states such as California. Expanding eligibility in this would reduce gaps in access to care and ensure that healthcare coverage is based on need rather than legal classification. This approach would improve public health outcomes. It will also reduce uncompensated care costs and promote a more equitable healthcare system. Senator Kelly, I respectfully urge you to take the following actions. First, support and advocate federal policies that allow states greater flexibility and funding to expand Medicaid-like coverage to undeserved population regardless of immigration status. Second, champion legislation that addresses the Medicaid coverage by gap, encouraging expanded eligibility threshold and closing gaps in access for low-income individuals. Third, collaborate with state, leader, and community stakeholders to promote innovative solutions that ensure all Arizonans have access to essential healthcare services. Your leadership is essential in advancing policies that promote health equity and protect the well-being of vulnerable populations. Thank you again for your time and for your continued service to the people of Arizona. I appreciate your attention to this critical issue and will welcome the opportunity to provide additional information or support efforts to advance this reform. Thank you so much.